Pharmacy 104, Chapter 6, Treatment of Depression. Objectives for Lesson 6.1 for depression. Learn the terminology associated with depression and its treatment. List and describe the functions of neurotransmitters associated with the symptoms of depression. Key terms will be found on Canvas using a Quizlet. So for an overview of the description of depression, this chapter talks about the treatment of depression. There are three primary types of depressive disorders: major depression, bipolar disorder, and dysthymia. I practiced that one about 50 times, and of course on tape, I bugger it up. Depressive disorders may be precipitated by hormonal changes such as in premenstrual syndrome, during pregnancy, or postpartum, from substance abuse such as alcohol or other depressant drugs, illnesses such as Parkinson's disease, heart attack, thyroid dysfunction, also things like chronic pain, cancer, other things can bring on depression. Heredity can also play a role, especially in bipolar disorder. Major depression is also known as clinical depression. It's associated with persistent feelings of sadness, emptiness, hopelessness, lack of interest in activities, fatigue, being overly tired, irritability, and the patient may suffer from insomnia, unable to sleep, or hypersomnia, where all they want to do is sleep. Bipolar disorder and dysthymia. Bipolar disorder was formerly known as manic depressive disorder, and it's associated with sudden swing of mood between depression and periods of mania. So mania is like a hyperactivity component. Patients have racing thoughts, their inability to sleep, they're easily distracted, they have increased goal-oriented directed behavior. It's like they can accomplish a whole lot very, very quickly. Dysthymia produces symptoms that are similar to major depression, however, the symptoms are less severe. So let's talk about the neurochemistry of depression. So there's a biogenic amine theory, and what this is clinical depression results from a decrease in stimulating hormones. Those are monoamine neurotransmitters in the brain, like dopamine, serotonin, and norepinephrine. So GABA may also be involved. There isn't a lot of information on this, so the chapter touches on it, but it doesn't really have any depth in that. Now, bipolar affective disorder, or that mania component, is believed to be associated with increased levels of those monoamine neurotransmitters. They're excitatory, so during the manic phase, there's an excess, so there's an overexcitability of those neurotransmitters. So here's a picture of nerves and synapses. So in depression, we see that there is a decrease in norepinephrine, and then in mania, there's an excessive increase of norepinephrine. The role of norepinephrine in treating or in depression: decreased levels in the brain are responsible for depression, and increased levels in the periphery can cause hypertension. For serotonin, serotonin is an excitatory neurotransmitter. More than 9 of the serotonin receptors have been identified, and drugs that block those are used to treat depression. And what that is it leaves more in around to make connections. Dopamine, there are 5 types of dopamine receptors. Dopamine binding is less involved in the treatment of depression than norepinephrine and serotonin.